Bom dia. Esquece fala português nesta sala. I believe most of you don't speak Portuguese in the magnifique city of Porto in Portugal. My name is Jean-François Bussière. I'm with Aurélie Guérin, live from Montreal. And it is a pleasure for us to give you this talk on pharmacy being a good option. We'd like to thank Fahmi Fouadi from the International Pharmacy Student Federation for his collaboration and giving us the opportunity of giving you this talk, and also Mylène Tisser involved in the face-to-face presentation with you. So we'll talk about pharmacy, obviously, pharmacy practice research, and how can this be used in your pharmacy student life, and moreover. Today's expectation of this talk are that we hope you will be able to use efficiently the website IMPACTPHARMACIE.org that we're going to talk about. We hope you will be able to identify the best evidences about pharmacy practice. And finally, we hope that you will develop an interest for the literature published about the role and the impact of pharmacists. I'm sure you do have many interests and you do read a lot on internet. At the end of this talk, you will have one more website that you can use for that. So let's talk about pharmacy practice research and the website developed by our research unit. We are located in Montreal. Montreal is in Canada, 33 million inhabitants, and Quebec is a French-speaking part in the eastern part of North America. Let's tell you briefly who we are. So the Pharmacy Practice Research Unit that I manage has the privilege of receiving pharmacy students from different countries, including Canada. You do get a list of significant pictures on the screen. Myself on the top with Denis Lebel and Cynthia Tanguay, permanent professionals in the research unit. Aurélie Guérin, that you will see in a few minutes. And many others from France and other countries that have spent some time with us. To start, let's give you a short view of important articles that support the pharmacy practice research. As you see, as you saw in the two videos that Mylène presented to you, things have changed, and more than that, things will change. Did you realize that pharmacy practices change from the old days when pharmacists were compounding drugs and having secret preparations to the industrial phase where we do buy now expensive drugs, and we have to know a lot about these drugs, how they should be used. But moreover, the role of pharmacists, if the society is going to continue to pay for that, is how the drugs are used by the patients. And do the patients get the results they're paying for? And are pharmacists making the difference? You got on the screen a long definition of what is pharmacy practice research. You know, a research that should inform and help us understand pharmacy the way it is practiced. What a pharmacy should be doing. And is he doing the right thing on a day-to-day basis? And all that is researched in order to ensure that pharmacists' knowledge and skills are used to the best effect of either solving problems or getting the results patients should get. Have you been exposed to the scientific literature about the role and the impact of pharmacists? The reasonable answer to that is certainly no. And why? It's probably because in the curriculum you're exposed to in your country, in a pharmacy or school of pharmacy faculty, most of the stuff we give you to digest has to do with pharmacotherapy. And frankly, probably most of the folks and the professors you work with know little or use little of that literature that evaluate and look at the scope of practice. Is a pharmacist doing this better than a pharmacist doing that? You will see with the website we're going to talk about that there's tons of articles, frankly not tons, but certainly thousands, and that includes systematic review and meta-analysis. And I have for you a pyramid that has been quite frankly published in many places. That pyramid of evidences shows that background information and expert opinion are at the bottom of the pyramid. They do have a lower level of evidence. opinions. If I tell you something that might be right and you might value my opinion because you like me and you believe I'm a good pharmacist. But what's at the top of the pyramid is really the systematic reviews. A systematic approach that will identify the very best papers conducted in the very best manner, randomized, controlled, all the quality we expect for clinical research that do apply to evaluative research. So we are looking at more systematic reviews. And the good news is that there are a lot of those systematic reviews in pharmacy as well for the scope of practice. Let's talk a few seconds about a project that will be published shortly in the Annales de Pharmacie Française. Our research group looked at the number of systematic reviews published about pharmacy. Let me give you the punch right away. 46 systematic reviews were published and retrieved, and 12 themes were identified. I would say 12 dominant domains or topic of interest. That includes systems, those that you are exposed to when you learn how the heart works and how the liver works. And so you see there are systematic reviews about the pharmacist in cardiology, geriatrics, nephrology, hematology, etc. If we look at what the pharmacists are doing in those systematic reviews, patient counseling is a dominant factor. Patient chart review, probably that applies more to the life of a pharmacist in a hospital, but it does apply to any pharmacist looking at the patient profile. Pharmacotherapy evaluations and recommendations, being in action, reacting to something that is wrong. So first piece, 46 studies that you might know or should know. Let's take one, and I just want to mention that briefly. We don't have the time to look at all the numbers and the quality of that key papers that was published in MedCare. That's interesting. It's a medical journal, and Chisholm Burns and colleagues looked at 56,000 titles and abstract, and came at the end with a small number in proportion of the initial numbers that they looked at of 298 articles about the role of pharmacists and its impact again. If you look at the blue box on my screen, you're going to see the therapeutic outcomes. I mean by that, a pharmacist having a positive or a negative or no impact on something therapeutic, something clinical. Let's read the first block together. We see this one, blood pressure. There's 59 articles. There are 84.7%, so 85% of those articles were a positive result has been demonstrated, with the significant p-values for the impact of pharmacists about blood pressures. Not favorable or positive results, none, and mixed results, 3%, no effect, 12%. Without surprise, to me, pharmacists have a positive impact on blood pressures, cholesterol, hemoglobin, glycate for the diabetes patients, hospitalizations or readmission rates, length of stay. So first point of this key papers, where you got 36 outcomes that they looked at, pharmacists in the majority of those studies have a positive impact and a significant impact on therapeutic outcomes. Second point, they looked at safety outcomes. So what is safety? Is not making a mistake, not making an error. Again, we do have big numbers, 78, 79%, 60%, 82% of pharmacists having a positive impact on adverse drug events or adverse drug reactions, med errors, or other patient safety issues. Third and last element of their big study is humanistic outcomes. So as a pharmacist, can a pharmacist have a positive impact on patient adherence, patient knowledge, patient satisfaction, quality of life? The answer again is in a majority of papers, or close to a majority of papers, we do find interesting results about pharmacists. But the pharmacy practice research field has also its challenges, and we are mentioning early and I 6 of those. You are not exposed to this type of research. Clinicians are not trained in that field. There's no relevant terms in the mesh of PubMed. There are methodological weaknesses. It's difficult to find comparable groups, and there's limited source of fundings to conduct all that and pay you because most of those studies involve pharmacy students, pharmacy interns, or residents. And in addition, we believe we will need to develop tools to make good choice in the field of health. I'm sure in any of your countries, health expenses are increasing at a point where the public system cannot afford, to continue to fund all that. While you can say, well, let's move private and do what the Americans are doing. We always like this comparison. U.S. and Canada are very close neighbors, good friends, and similar countries. But in the case of healthcare sectors, they do pay twice the amount of what we pay in Canada for similar results or even lesser results when you look at life expectancies or complication rates. So will money follow our hope, our expectations? Maybe not. So there are other things that we should take into account, and we need to know the evidences about pharmacy practice models to make these choices. Looking at pharmacy practice research, you should ask yourself questions. What is the optimal training for a pharmacist? Are you in a good faculty, in a good program? Do you believe you're exposed to the right set of documentations, of research, of content that you need to be a good pharmacist? What are the pharmaceutical activities that you should practice, you should use, and are the selection you made as a positive impact on patients and the healthcare sectors? In what patient care programs should you focus your activity? Should you work in diabetes? Should you work in intensive care? Should you work in geriatrics? And so you should target programs as well as conditions or disease. And what are the data available? So that's why, having said and having put these things into context, that's what our website Impact Pharmacy is trying to address. So I'll give the mic to Aurélie. She will explain to you how the website has been developed, and I'll be back later.
In the context described by Jean-François, research team decided to identify and gather the evidence and the role and the impact of pharmacists. This work has taken the form of Impact Pharmacy website. But how do we work? The project involved 5 major steps: the choice of theme, a bibliographic research, a summary post-study, a summary per team, and a knowledge transfer. The first step was a selection of the theme. We chose 3 dimensions: pharmaceutical activities, patient care program, and disease. 23 pharmaceutical activities were chosen, for example, medical rounds, drug therapy evaluation, patient counseling, and teaching. 28 patient care programs were chosen, for example, geriatric and pediatrics. 19 diseases were chosen, like asthma, diabetes, and hypertension. For the second step, a literature search on PubMed, Embase, and Google Scholar was conducted for each team. Articles about the role and the impact of pharmacists in French and English from 1990 to days of search were included. We included all the designs. Then, for each article included, an analysis was done. Each analysis is available on the website. We have collected for each article some information such as the reference, year of study, country, design, randomization. We chose 8 categories of outcome: cost, error, adverse effect, morbidity, mortality, compliance, satisfaction, and other. We have collected the description of the intervention of pharmacists, and we collected the indicator of results, like the length of stay in hospital, the blood pressure, the satisfaction of the nurse. After reading all the articles for a given theme, we wrote a summary page per theme containing all data. Each summary contains 3 sections. The first one is a summary, context, and definition section. The second one is a section on the impact of pharmacists, and the third one is a descriptive section on the role of pharmacists. The section on the impact of pharmacists contains all the statistical indicators collected in article. Each indicator was classified in the 8 categories of outcome. If an indicator was positive, it was illustrated by a happy smiley. If it was negative, a sad smiley was associated. The exact English wording of the indicator was kept and an English translation is underway. The descriptive section of the pharmacist rule include indicator without statistic. Finally, everything is presented on our website, IMPACTPHARMACIE. In addition to the website, a French weekly blog with an analysis of recent articles about pharmacy practice was started in March of this year. Moreover, an international diffusion of this website is underway, and it includes presentation in various scientific meetings. For the navigation in the website, you can choose a theme of your choice, such as diabetes. You can click on a reference you are interested in, and finally, you can access the abstract and the article when it's available. The project was led by the Pharmacy Practice Research Unit from Saint-Justine in Montreal, under the direction of Jean-François, and the project received an unrestricted funding from the Ministère de la Santé et des Services Sociaux du Québec for the start of the project.
So let's look at the website itself and the results. This project, this 1 year, 16-month project up to now, has led to the identification of 70 themes. These being either pharmaceutical activities, 23, patient care programs, a total of 28, or diseases with a total of 19. We were able to retrieve 1,442 articles, of which 914 articles were analyzed. More detailed descriptions of the paper was included. Quite frankly, in the futures, any articles that we will identify will get a full coverage in the database. But I guess, with the learning curve of this project, we had to make choice considering the time and the relevance of the things we were exposed to. One more good news. A total of 1,427 indicators were identified with statistical analysis. That means that, during research, people were able to compare A to B and find a difference between pharmacists without pharmacists. No surprise that pharmacist has a positive impact. We said earlier, 803 indicators were positive, 596 were neutral. Oh, I see you. I can hear you, oh, we don't make a difference all the time. And yes, the answer is yes, certainly. I mean, a pharmacist is working in collaboration with nurses and physicians and others. Frankly, it's possible to not to have an impact in some cases. Either the patient doesn't understand, doesn't want to participate, the drug doesn't work. So neutral impact is positive. Only 28 indicators were identified in all these studies as being negative, and that is surprising, frankly, because pharmacists can harm patients like any other healthcare professionals. And the reasons why we get so low number is a publication bias. You don't tell your parents when you do dumb things, and researchers don't like to publish their negative results. This table, this figure, shows the dominance of the North American literature and the need to interpret the results with the context of your country. So you may say, well, it's been done in the US. We're not in the US. I'm living in France or in Germany and Poland. And well, don't reject too quickly the literature, because if a pharmacist in any country can have an impact, it may apply to your context. But when we include the economic aspect, well, that may not apply. When we look at how the intervention has been proposed, well, maybe the scope of practice in your country is not at that level, or does not allow you to do that, but you are the future generation. You are the people that will make a change, so please consider things that happen elsewhere than in your country. When we look at the content of what we retrieve in terms of designs of studies, again, you see numbers. I don't want to push too much the number in the presentations, but you get a lot of meta-analysis, systematic reviews, and more controlled. Let's recall the pyramid we saw earlier. Oops. Parachute. I can't see you, unfortunately, but I'd like to see the hand raised in the room. How many of you have had a chance to try the parachute? I guess a few of you have done that. Myself, no, I've got vertigo, so I can't do that. In the British Medical Journal, they do publish sarcastic studies. and they did a systematic review about the efficacy of parachutes. I'm not going to read you the long conclusion, but I can tell you that there's no evidences that parachute works because there have been no studies against a control group. And imagine yourself taking part to that studies, just getting out of the plane at a few thousand meters, and you've got the placebo. And yes, it doesn't work. So we don't need to do the study. We know parachute works, but we will never conduct a study without with placebo. Sometimes it's not ethical to do placebo. Is it ethical to not to provide pharmaceutical care or pharmacy services to patients? Well, in some cases, the answer might be no to that. So the take-home message for that is no evidences in terms of systematic review doesn't mean no impact. Again, many numbers, just to, I believe we are before dinner, before lunch, and so you should be awake. Again, you can see in the red box the distribution of positive impacts, indicators, I mean, for cost, adverse effects, errors, morbidity, mortality, observance, satisfaction, and other. The point we want to make by showing you that is that the 8 markers that we've used in terms of indicators, they're recognized largely in the literature about pharmacy practice. We do get positive pharmacist impact in all of these. A quick note on another study that we conducted, it's also under press. We looked at the numbers of articles published that describe the role of pharmacists, but other professionals. It's like a billboard of where pharmacy stands versus other professionals. And I'll bring you the figure, which shows that pharmacists, in terms of meta-analysis and systematic review in the last years, we're talking, the last 5 years, no more. Pharmacists in that billboard, have more stuff than nurses and than physiotherapists, occupational therapists, dietitians, or respiratory therapists. And I don't know in your country, but in Quebec, there's 10 nurses for 1 pharmacist. So if the research would be conducted in the same proportion, then the numbers of faces working in each profession, nurses should be 10 times higher than pharmacists. So the take-home message for that is that we're good, and there's significant amount of research conducted about the impact of pharmacists. We're about the end, Aurélie. What can they do? Well, you can do a lot. You can complete your pharmacy degree. You can work for patients rather than for money. I'm not telling you to work for free, no, but I'm telling you that patients should be the center of your preoccupation. You should remember from this talk that there's 70 themes, 1,000 articles, 8 categories of issues. Clearly, pharmacist has a positive impact. There's a publication bias for negative studies. There's a need for evaluative research, and it's emerging, and pharmacists are essentials. A pharmacist is an essential healthcare player in the healthcare arena. We hope you're going to use the website, and with Mylène you will be exposed live to how this thing works and how can it be used. So you can consult the summary page that we provide you. At the same time, you have a pharmacotherapy course. For instance, you're exposed to asthma pharmacotherapy, beta-2 agonist, and other drugs, and you say, how, as a pharmacist, am I going to measure my impact? Not necessarily in a study, but just with patients you see. Again, the website can be used during your internship to compare your practice with the literature and see the pharmacist that my role model that I'm exposed to, is he doing what we see in the literature? Is he measuring his activity? You can also use that just for yourself, just as a personal guide to think about how you want to practice pharmacy in your future. You can also talk about the website and tell the news to other colleagues in your faculty, professors. You can try to measure your impact yourself. There are publications about the impact of pharmacy students and pharmacy residents. Well, more than that, you could maybe submit an article and your idea to our research team or to a journal. So At distance, it's probably tougher than being there and and having a chance to talk with you and answer your questions. So we apologize for being away across the ocean. We hope this talk will give you the taste to really look at pharmacy practice, to be a pharmacist active not only at the patient level, but at society level. And please, if you want to follow us on our blog, you get a chance, click on Suivre, follow, and you will receive a weekly news from us and comments about recent studies published. We wish you an excellent meeting, and thanks again for giving us the chance to talk to you. Bye, everyone.